In this video, we'll study about the branches of the third part of the maxillary artery. The first branch we'll see is the posterior superior alveolar artery. So this is the posterior superior alveolar artery. The name itself indicates it supplies the posterior part, which is the premolar and the molar teeth of the upper jaw. Posterior superior alveolar artery. So this artery arises from the maxillary artery before it passes through the pterygomaxillary fissure, and the artery divides into branches and enters through the foramina, which are present on the posterior surface of the body of the maxilla and supply the molar and the premolar teeth, and also the adjoining gums and the mucous membrane of the maxillary sinus. The second branch we'll see is the infraorbital artery. The infraorbital artery arises from the maxillary artery before it passes through the pterygomaxillary fissure, and it passes through the infraorbital fissure, infraorbital groove, infraorbital canal, and appears in the face through the infraorbital foramen. It is accompanied by the infraorbital nerve. In the orbital canal, it gives rise to the middle and the anterior superior alveolar artery, which supplies the maxillary sinus, the canine and the incisor teeth of the upper jaw and the adjoining gum. In the face, it gives off branches to supply the medial angle of the eye, the lacrimal sac, the side of the nose, and also the upper lip. The next artery we'll see is the greater palatine artery. So this is also known as the descending palatine artery. It passes through the greater palatine canal and appears in the posterolateral corner of the oral surface of the bony palate, and then it runs forward in the groove close to the alveolar border, and the terminal part of the artery runs upward through the lateral part of the incisive canal and anastomose with the long sphenopalatine artery. The branches of the artery supplies the mucous membrane of the roof of the mouth and the adjoining gums, and while in the greater palatine canal, it gives rise to the lesser palatine artery. The lesser palatine artery passes through the foramina of the corresponding name and supply the soft palate and the palatine tonsil. The next artery we'll see is the pharyngeal artery. The pharyngeal artery passes through the palatinovaginal canal and supplies the mucous membrane of the nasopharynx, auditory tube, and also the sphenoidal air sinus. Next artery we'll see is the artery of the pterygoid canal. So this artery passes backward along the pterygoid canal and supplies the pharynx, auditory tube, and also the tympanic cavity. So the next artery we'll see is the sphenopalatine artery. The sphenopalatine artery is the continuation of the maxillary artery after passing through the sphenopalatine foramen. So this is the sphenopalatine foramen. It passes through the sphenopalatine foramen and enters the nasal cavity, and here it divides into posterior lateral branches which supplies the lateral wall of the nasal cavity, and also the posterior septal branches which supplies the posterior part of the nasal septum. The posterior lateral nasal branches ramify over the concha and the meatus and supply the sphenoidal and the ethmoidal air sinuses, and the posterior septal branches crosses under surface of the body of the sphenoid and passes forward and downward along the nasal septum, and one branch is long and runs in the groove on the omer towards the incisive canal and makes anastomosis with the terminal branch of the greater palatine artery.